digital healthcare models. Everyone's heard of the digital front door now, right? Or at least a lot of you have. The whole concept is that people don't have to walk through the door physically. They can come through digitally through technologies like Life Health, which is very, very important. But one thing is that you as an organization have to develop a plan, and as part of your mission as an organization within all the different organizations we're talking to, I think we said there were 314 different hospitals, is that you integrate this as part of the plan of how you choose, or maybe it's an individual provider that you're going to provide care for your patients. Because what we see if that doesn't happen is that we'll have a few doctors who are doing a lot of it, and we hear all these great things. Oh, this hospital over here is doing this, and that one doctor moves away. Those two doctors move away, or something happens, and the whole program collapses. It really has to be built into the actual fiber of the organization and into the plan of how we're going to take care of a given population. Those are the programs that do well. Those are the programs that increase revenue, increase patients. And so it's not based on individual people, it's based on the structure of the operation of the program, like any other program. That's number one. The number two thing that is, this is a program like anything else. You have to market it. You need to market it to your customers that this is an option. And when you market this to your customers, that they can enter the healthcare system without having to come to the facility when it's appropriate, that you're going to get increased use compared to others doing this, and you're going to capture patients. Number three is just really understand your program of inclusion, exclusion criteria. Like, when do we want, Dr. Sam, I'm sure could, as a clinician could give a lot, maybe we just say, okay, like in Switzerland, every single call that comes in, they do it virtually first, but that's an inclusion, exclusion criteria call where they decide if they can handle it virtually. What we find out, if you look at organizations like Kaiser Permanente in the US, they say that they can manage 70% of urgent care visits virtually. They don't have to have 70, they don't have to have 7% of the people come in, 70%. They believe they can treat that high level, and it's durable treatment. University of Texas Medical Brand says, hey, if you do a call urgently, that they track those patients for 90 days and they save, and this is in US dollars, of course, which the healthcare system over here is outrageously expensive, but they can save $128. So it's not like they're seeing the patient virtually today and then we're like, okay, we saved them from going to the emergency room. They track that patient for 3 months and say, okay, over those 3 months, they didn't use other services. So it was an effective treatment. It was a durable treatment. And the third thing is, healthcare, we're here to help people. We all get into healthcare because we want to help people, but also think of the business side of healthcare. That when you look at implementing a program like this, the reality is that the dollars and cents, and that there's a bottom line matters. And one of the pushes of this type of technology is, if you're doing it, is that it will help you to retain patients that you have, and to increase access to new patients, and gather what we call, patient mindset and patient market share. And that's important, right? And the beautiful thing is that we're helping patients, and we're helping more and more, and we're lowering the barrier to the entrance point to healthcare that can be managed effectively regardless of where the patient's at.